Hello everyone, good morning. Welcome to day 39 of Fine Health COVID-19 live updates. How are you all doing? I hope you are all keeping yourselves safe and healthy during this time. It's really good to be able to come to you wherever I am, and today, as you can see, I'm in my office as I'm on call, but I wouldn't miss a day not talking to you. I'll keep going, so please keep sharing all these videos and the ideas that we bring. So today I'm going to give you the updates as usual. As you know, Vine Health, what we're here to do is to give you facts and not fiction, to tell you what's been happening in the last 24 hours, and to give you tips on how to survive and how to thrive during this period. Today I'll be talking about Ramadan, because I think Ramadan starts tomorrow. For our Muslim brothers and sisters who are on here, who watch this, please correct me if I'm not accurate, but I suspect that I think it starts this week. So, and it's a month-long holy month for Muslims, where they observe a fast, and this is particularly so important with your health as well. And as medics, we do a lot of research into Ramadan and the effect on our health. And with the COVID-19, it's doubly important that we talk about it. So I'll talk about that. But before I go and talk about all of that, we will go into what's happened in the last 24 hours. Well, not much has changed. In the UK, the death rate is still gone up, slightly less than the day before. Over 750 deaths up until yesterday at 5 o'clock. So, well, we're still hanging in there, and we're just still sort of all going. I really don't like talking about the death toll, but that's still going on, as we know. But in the UK as well, as we know that Black people are dying more. And what's even more upsetting is the fact that Black medics and Black people that work in the NHS are dying more. So over 70% of the deaths are for Black doctors, nurses, admin staff, which is quite upsetting, and an in-depth review is being looked at into that. And the reasons that have been cited are really interesting. So if you have any Black people in your family who work in the NHS, keep an eye on them, advise them. There are no heroes in this game. And because of some of our work ethic and our work practices, we take a lot of risk that really is not advisable. Some of the risks that people in my profession will take is maybe to go into a situation with not appropriate PPE because you're trying to do the best for the patient, or maybe you're worried about your superior. Your superior tells you have to go and do this, and then you do it and put yourself at risk. Don't do that. If you're in a situation that is unsafe, it's better for you to say to them, I'm not comfortable with it, and make sure you write a letter afterwards to state why you're not comfortable with it, and forward that letter to your occupational health and to your human resource department. Don't be afraid to complain. One of the things that the Black people generally, and Black, so I know, is that we kind of are a little bit worried about complaining or responding to complaints, or just saying or just claiming our rights. And it's so important, because in the Western world, unlike in Africa, in the Western world, if you don't write it down, it hasn't happened. So if something has happened to you and you don't actually document it, write it down, complain about it, it hasn't happened, right? So I always say all your responses should be written down. I think that's one of the reasons why we're having more Black fatality as well. So yes, we have a lot of underlying conditions, but honestly, other races have underlying conditions as well. It's higher for Southeast Asians and Black people, but many people have underlying conditions, but the death rate is still higher. So over 70% of the deaths are Black, but they only account for 21% of the workforce. So that tells you that there's something not quite right going on. Yes, so absolutely, you have to be assertive. There's no fear in these things. We're not saying be rude or be arrogant. We're saying know what your right is. Put your point forward very clearly without emotion. It's not about emotions here. It's about stating the fact very clearly. And I always say to people, I've worked in NHS leadership for over 10 years, and I'm actually an expert at writing these letters, because I've read so many of them, and I know what people are looking for when they read letters of complaint or letters that are states you're trying to state your right. People know you. If people know that you know you're right, they wouldn't really put you into dangerous positions. So I'm not going to see any patient who is COVID possible without full PPE, and there's nothing anybody can do about that. I won't do it because I know that it's not just about putting myself at risk. I have, you know, I have families, I have people who are vulnerable in my family, and there's no chance that I'm going to put anybody at risk. And if I feel that I'm being pressured, I will document that and forward it. All right, so I'm sure there are people in the community who know how to write letters. And so if you are struggling, if you're in the profession and you're struggling, and if you know you can help support people, please, you know, offer your help. There's no success alone. Success is only done when you're a group. You know, one person being successful is actually pointless, to be honest. Right, so that's that. Also in the UK, they're talking about masks today. And there'll be a formal discussion about whether everybody should wear masks in public. And you all know my stand on that. It's my personal opinion, not my professional opinion. My personal opinion is that you should wear a mask. You should wear a mask, you know, not just to protect yourself, but to protect others. There's some of us who are Typhoid Mary. If you know the story of Typhoid Mary, that's the lady who never showed any symptoms of typhoid herself, but she spread it to thousands of people because she's just one of those people who didn't show the symptoms, but they have the virus. So just protect yourself and protect others when you're going out. Wear your mask, social distance, just move back a little bit, and just I think you should wear a mask. Just cover your mouth and your nose. Is my view. And the vaccine in the UK is being tried today, starts today, and they'll be trialing that on about 500 people up until mid-May. And if that's working well, then they will sort of roll it out. There's also another trial for households, so you might be getting a letter in your house to say you should get involved in a trial. Always say yes. I mean, as far as it's not like they're giving you the vaccine, if just for you to get involved with taking swabs and things, it's so important. Because another thing that we don't do very well in the Black community is that we don't get involved in research enough. I've just been sent a research paper this morning, and I'm going to say yes. I'm going to get involved in that research. If we want to be healthy, we also have to offer ourselves forward for research as well. So if you get asked to participate in research, particularly if it's just for them to swab you or take samples from you, please say yes. Offer yourselves up for research. So that's all for the UK. The United States, again, is a total shambles, but Trump keeps saying how well they're doing. I find it very interesting. It reminds me of a child, and I have huge respect for Donald Trump because he became president, despite the fact that we all didn't think he was going to be. He did become president, so he must be doing something right. But whenever you watch his updates, he's always saying how fantastically well he's doing. And it just reminds you of toddlers and young people where they say that, you know, they're doing really well even when they're not. So the deaths in the United States is now over 47,000, which is really not good. But they are still planning to open up lots of their economy and shops and things. And so again, good luck to them. If you're in the US and particularly if you're Black, stay safe. Just stay safe and stay strong. And they are also doing their research as well, and they're rushing around to support other countries, which is wonderful, which is great. Don't forget that the European countries are doing quite well. Germany is doing well. They're also trialing their vaccines this week, as far as I remember. Denmark, Czech Republic, they're all doing quite well, and they're not really shouting as much, and much of the attention is not on them, but they are doing well. Nigeria, I'm really worried about because it's gone up to, the new cases has gone up to 873. I was hoping that it wouldn't double by Saturday. Double from last Saturday will be 986. So I'm keeping my eye on that. The deaths is now 28. We just hope that this will not escalate. But the lockdown is still on. Many of the people I know that were stuck in Nigeria have been repatriated back to the UK, which is great news, so you can come back home to where you live. There's still insecurity, there's still problems, but every community, every society has its own individual problems. So you just have to deal with it as you go on. So lastly today, I'm going to talk about Ramadan. So to all my Muslim brothers and sisters, congratulations on this next month of reflection and this month of fasting where you deprive yourselves. I think the Christians have had the Lent and now we have the Ramadan coming on. But I do know that Ramadan is also a time where people with chronic disease and chronic illnesses get themselves into trouble because they genuinely want to fast, and some of them are not supposed to fast. So I'm going to post a guide after this onto the Vine Health page so that if you're Muslim, you can have a look. For those of you that should not be fasting, please don't do it. And if you're going to fast, or if you're going to modify your fast as well. Also, COVID-19 can lead to a lot of dehydration, and the symptoms can cause dehydration. So if you're Muslim and you're fasting and you have symptoms of COVID-19, please just tailor your fast. Make sure that you're drinking lots of water, or don't fast at all. But also with chronic disease, things like diabetes. I was saying yesterday that can you cure diabetes? No, you cannot cure diabetes, but you can be in remission. So you can have normal HbA1c. And during this Ramadan time might be a time to work on your diabetes, even if you're not Muslim. I have had many patients who have gone from having very bad figures in their HbA1c, which is what we call the monitoring for diabetes, to having normal readings. And what they've done is really cut down very low on carbs, on refined sugars, and on the number of and how much food they eat a day. And they're having little and often. So one of the secrets is to have little amounts of food often spread throughout the day, which is meant to keep your blood sugar even, and on the long run keep your HbA1c down. And with diabetes, exercise is also very important. The smaller your waistline, the better your diabetes will be, right? So it depends on how motivated are you to reverse your diabetes. I talked about the science of motivation the other time. You have to have a really good why as to why you want to do something, because simply having diabetes does not mean that you're motivated to change your behavior. Because I still have patients whose diabetes control is horrible, and I always say to people that I've had someone tell me before that, look, listen, I like to eat, I'm not going to stop eating, I'd rather cut off my right arm than stop eating. So they're not motivated to change. But if you're motivated to change, then you can reverse your diabetes, which is really strictly monitoring your intake and your how much you're eating, how much you're drinking. Make sure you're drinking water. Water is so important. If you're diabetic, you really want to be drinking quite a lot of water. Drink drink at least 1.5 liters a day. Almost have a food diary. I think a food diary is very useful, so you know what you're eating every day, and exercise regularly. Also be very attuned to the signs and symptoms that you display. Many people go very quickly into hypoglycemia, where their blood sugar drops, and a drop in blood sugar is not good. Neither is a very quick rise in blood sugar. So you want to keep your blood sugar level, and the way to do that is to have little and eat little and often throughout the day, and check your sugar levels. Even if they don't give you a blood sugar machine, get one yourself and just check it. So until you have very level sugars. Look at your motivation. Write down your target. If your HbA1c, for instance, is over 50 and you want to bring it down slightly, have a target. Discuss it with your GP and have a good plan. There are people who have done it, and you can do it as well. And this Ramadan period might be a good time for you to work on the diabetes. It is so important to work on diabetes. The reason why is that because diabetes causes target organ damage. So it's not just about having diabetes, it damages everything. So your eyesight gets worse, your heart gets worse, your kidneys gets worse, your skin gets worse. It's just gets recurrent infections. So you can only benefit from having very steady blood sugars. So that's everything today. I have to get back to work, but I will post the guidelines for the Ramadan. If you have any other questions, please ask them. And good luck with the Ramadan. Carry on with your reflection. I hope you get everything you're planning and hoping for during this period. And please like the video, share it with as many people as you can share, like the page as well, and send your questions and comments. I haven't really picked up any in the last day. I haven't checked, so I'm sorry if I've missed any questions you've sent, but please send your comments and your questions to me. And just call somebody today. Keep an eye on your mental health. Keep an eye on your mental health. Remember that the mental health is like the foundation for everything. I always say that You can talk about diabetes and everything, but the foundation of everything is your mental health. So keep an eye on your mental health. Call a friend today, be a support to somebody, help somebody else. When you help somebody else, you feel better in yourself. Thank you for watching, and I am so grateful for it. And I'll see you again tomorrow, day 40, and we'll carry on our conversation. Have a great day, everyone. Bye.